Do you have a live? You don't? All right.
I'll put it down.
Thanks.
That looks like
That'll work.
Yeah, we're going to be starting in about 2 minutes.
I hope so.
Annalisa, can you go do a test?
We're going to get started in just about 2 minutes.
I didn't hear.
You didn't hear it? Just reason. In just under 2 minutes, we're going to get started. I think you'll find it right in there. Hey, what's that? No problem.
Okay.
All right, good afternoon, everybody. John Ward, Director of Emergency Management here at the Unified Command. We're responding to the COVID-19. I wanted to, as I'm always going to say, Clay County Emergency Management, Clay County PCC is working closely with all our partners in this, all our first responder partners, the Department of Health, Sheriff's Office, Fire Rescue, and all our municipalities. And we are thankful for those relationships because we see those relationships aren't like that all over the state. So that's what's making us successful in this. This is day 42 of your staff's been working long days and long hours for the response to this. And I want to thank everybody that's been doing that. Today, we're up to 257 cases and 11 deaths. I do want to say the one major thing that has changed since our last press conference is that the state is now releasing the names of the facilities that have had cases at it. The one thing I do want to say is that is a concurrent list, so they could have had a case at it a month ago or 6 weeks ago, and it's still going to be on that list. As they get cases, it's going to continually to be added for that, and it won't be taking off. The one thing that will not be released and will not be discussed as the state manages this information is the numbers that are at each facility or if there's been any fatalities at each of the facilities. So they're releasing the lists because of all the questions that were asked, but they are releasing that list as we move forward. The one thing I do want to talk about, we've also received a lot of questions on what I'm going to call the state facility incident management team. I kind of want to describe that a little bit. We are fortunate to have that team based out of here in Clay County, but I want to describe what that is because just because that team is here does not mean that they're, all the nursing teams and everything are here. What we have is we have what's called an incident management team. It's a regional incident management team that many of us are a part of that they've brought in to help coordinate and organize these resources that are coming into our Northeast Florida area. So here at the EOC, we have an 8-person incident management team that consists of an incident commander, an operations chief, a logistics chief, a deputy logistics, and the logistics are the ones that coordinates the supplies and resources coming in and out of the region, planning, a deputy planning, and they have a health department regional advisor, and then they also have what I'm going to call a nursing safety person. So as the nursing teams come in, they do come here to Clay County. We're fortunate to have them staying here in Clay County. They get briefed in this room that we're in now. They get a safety briefing, and then they're sent out on a mission. And those missions could be in Marion, Nassau, Levy, wherever those mission sets are. This is just where that management team is based on it. The nursing teams, they currently have 7 teams of nurses and 4 task forces of veterans, nurses and doctors that are here. And they have 1 guard medical team that is coordinated out of this. So it's a total of 60 plus doctors and nurses that are all being coordinated right here out of the Clay County Emergency Operations Center, the state team, and then again, they're going to many other counties. None of the medical teams are currently in Clay County as far as working that. We were fortunate, we got those resources early on. They did that, and now they're out in the other counties kind of replicating what they've been doing in other counties. We know these have been very trying times for our residents out there, and we had a special guest this morning with Clay Behavioral, and we really want to let our folks know that we do see the end in sight. We're working with the governor's office to try to develop what that reopening plan looks like. It's his executive order that is currently keeping our businesses closed in the stay-at-home order, so we're really wanting to work with them and see what that looks like, and we're working with a lot of our partner agencies as to what I'm going to call a reopening plan looks like. It's not going to be flip a switch and everything come back on at once. The trends do show a flattening of the curve because of the physical distancing you guys have been doing. We're all in this together. It's our residents and our partners that have been working this and helping this not be as bad as what they originally expected it to be in our community. There will soon be a new normal in Clay County, and that's going to be the keeping small gatherings. It's going to be special precautions when we're out with our normal residents, and then our travel and those type things. So we're working with our state and federal partners as to what that's going to look like, but there will be a new norm very soon here in Clay County. The one thing I want to talk about is what we've been pushing is we're still hearing that there's some residents that are in need of food. There should not be a Clay County resident that needs food. If you need food, please go to alert.claycountygov.com or call 1-877-252-9362, and we can get you assistance in getting food from one of our food banks, or we even have deliveries out there for residents that can't leave their home for whatever reason. We do have volunteers that have been vetted, and they've been delivering the food for us out there. So far, to date, we have the seniors have are feeding about 1,500 meals per week. The schools have fed about 18,121 meals, and our food banks have served about 143,770 meals. So totaling 164,939 meals that's been served from our various operations that we have here in Clay County. We do have our citizen call center that is open Monday through Friday, 8 to 5. And that number is 877-252-9362. So far, to date, we've fielded 5,024 calls for service questions to our citizens. So I encourage you, if you have any questions about this event, please feel free to call that. And then, as always, I want everyone to keep the correct information as we move forward. There's going to be a lot of moving parts, just as it was moving very fastly when we stood up. It's going to do that on the backside. So if you have any questions, please stay tuned to our website, thealert.claycountygov.com, or call our call center to get the most updated information. Clay County, I want to thank you so much for being in this together. We are Clay County strong. I'm now going to turn it over to Ms. Heather Huffman to do her brief.
Thank you, John. Thanks for your partnership during this event. I greatly appreciate it. Just to give the latest updates, we're currently at 257 cases. 2 cases are in non-Florida residents. We currently have 11 deaths, and that's about a 4% mortality rate. We currently have tested more than 3,000 individuals, with 2,800 of those coming back negative. Hospitalizations, and that includes ever hospitalized, not currently hospitalized, about 19% of all of our cases have been hospitalized at one time or another. The latest updates are always on the Florida Department of Health COVID website. Those numbers are updated twice daily at 11:30 and 6:30, and that's where you can get the latest numbers. It breaks it down into zip codes, ethnicity, race, those kinds of data sets that you would be interested wanted to speak a little bit today about long-term care facilities. That has been a high priority area, not only for the governor and the state surgeon general, but also for us here in Clay County. We currently have 7 facilities out of our total 28 facilities that have had cases in them, and that may be one or the other of either a staff member or a resident or a combination of the two. What we've been doing thus far, and this has been since the beginning of the 42 days that we've been doing twice a week calls with these long-term care facilities and hospitals to discuss current issues that they may be having. We may also be talking to them about issues related to education, infection control practices, and PPE needs they may have. We have started this week, in addition to those 2 times a week calls with those facilities, we will have started this week doing an actual call down of ALFs in nursing homes 3 times a week by my DOH nursing staff to reach them individually and have one-on-one conversations about their needs and their facilities, about not only their residents, but PPE needs and staffing needs. Related to the IMT staffing that we've been able to get with the regional IMT, we were very fortunate to be the pioneers to have the regional IMT strike teams come into Clay County. Some of their tasks and duties included swabbing of all residents and staff in 4 of our facilities that have had outbreaks. We've been able to do nurse education and hands-on infection control practice training with those staff that work within those facilities. We've been able to bring in RN preventionists that have been trained in infection control practices to be able to perform assessments on infection control practices and gaps, looking for those gap analysis. And lastly, to make recommendations to facilities when you do have staff residents that are, residents that are positive in a facility. How do you isolate them, and then how do you isolate them within a facility if you have a group of them? I would be remiss not to thank my staff, who are, I feel very blessed as a health officer to have the best staff as far as the county health department, but especially to my epi staff. We typically have 2.5 epidemiologists on staff. We've been able to bring internally within our own staff an additional 3.5 people, so we have 7 individuals working cases and doing those contact tracing and those interviews, and they have been doing same day or next day interviews with every single positive that we've had, including contact tracing. That is a tremendous amount of work. They have been working 7 days a week, 10, 12-hour days in order to serve the community. So at this point, I'll turn over to Mr. Wanamaker. To Sheriff Daniel, excuse me.
Hey everybody, me again, Sheriff Darrell Daniels. I want to give a shout out to the men and women of Clay County Sheriff's Office who are tirelessly out there serving and protecting the citizens of Clay County. This morning, some of the men and women of Clay County Sheriff's Office served a narcotics search warrant on Stagecoach Drive, and that netted a couple of firearms and some drugs, methamphetamine in particular. There's a 5-time convicted felon who was in there selling methamphetamine, and just want to announce the fact that we got him off the streets. Just a little bit of follow-up for one of our employees who had the COVID-19 flu. That employee tested negative and then positive, so the employee is back in the waiting pattern again to come back to work, although in good spirits. At the Sheriff's Office, we're continuing to do what we need to do to make sure that our employees are safe. We have had 0 folks in the jail, the inmates who have come down with this COVID-19, and none of the other employees other than that one I spoke about. For the citizens out there, continue to do what you're being asked to do by way of the executive order and the CDC guidelines. One thing, that I'd be remiss to speak about is the fact that, we stand at the podium and we talk about washing your hands and doing the things that, have been ordered through the guidelines. But, that's under the assumption that people know how to wash their hands. And we talk about universal precautions as if people already know what universal precautions are. And some of you out there, and I hate to say it like this, have some of your same nasty habits that you had before this thing came to be. So when you wash your hands, why don't you do me a favor? Look at Google. Google knows everything, so I'm told. And look at what universal precautions actually are to get the basic one-on-one on what washing your hands actually looks like. It's not that little rinse spritz thing that a lot of people do. And enough of that, because I'll be out of my lane if I talk a little further on that. I want to give a shout out to the people at the Clay Chamber who we checked on today. Just gave a drop-in visit on those folks. Albeit they're closed to the public, it's dropped off some disinfectant to them, and they're doing a bang-up job over there with building masks, for the citizens of Clay County and some of our other stakeholders. So that's our update from the Sheriff's Office. I appreciate everybody's compliance. We have not had any negative interactions of non-compliance, nothing noteworthy. So next person up will be Superintendent Rossi.
Thank you, Sheriff. Just want to give a couple of quick announcements. As you know, on Saturday, Governor DeSantis has closed all public schools in the state of Florida, which means in Clay County we'll be practicing distance learning for the remainder of the school year. I also wanted to announce that we have moved our graduation ceremony, which was formally scheduled for May 29th until July, and a specific date will be forthcoming. We believe that it's important to have a traditional graduation ceremony. We overwhelmingly heard from the class of 2020, as well as parents and the community itself. And so we will have a traditional graduation ceremony. Of course, we'll have to follow the CDC guidelines, state and federal regulations that are in place at that time. So more information will be forthcoming. We will release information in the coming days related to the pickup and drop-off of various items. If you recall, at schools at the end of the school year, there's a procedure. Students have textbooks, they have Chromebooks. Schools have personal items that students left there. We want to consult with our partners at emergency management as well as the health department and ensure that the process that we go through at the end of the year meets the guidelines for the safest possible distribution and collection of materials at that time. We're very proud in the Clay County school system. As Mr. Ward had announced, we have delivered many meals to students in need. We will continue to do that at our 17 sites that are listed on our oneclay.net/coronavirus website, and that's from 11 to 1. Students will receive 2 meals at that time. We heard parents, they didn't want to make 2 trips to the school, and so you get 2 meals at 1 trip. Chromebook distribution and repairs are still going on at this time. You can find that schedule on the oneclay.net/coronavirus website if you have an issue with your technology. Lastly, I just want to give a shout out to our teachers, our students, our parents, and our school leaders. I couldn't, in my wildest dreams, imagine that distance learning would go as well as it has. I appreciate everyone's grace and compassion and flexibility as we all learn together in a new format. I thank you so much as superintendent of the schools. Next, we have Mr. Wanamaker.
All right, good afternoon, ladies and gentlemen. I want to thank John, Heather, Sheriff Daniels, and Superintendent Brodsky for your latest updates. I also want to thank our first responders, doctors, nurses, and health department staff for keeping us and continue to keep us safe daily. Thank you. Now, we must stay the course. We continue to monitor and manage our response daily to this COVID-19 pandemic with an eye on those infected and those that require medical care. We're also focused on reopening Clay County. The President's phase plan begins with 3 gates. Those are symptoms, cases, and hospitals. Once we make it through these gates, we can begin the 3-phased approach. This is an extremely stressful time for all of us. I want to encourage everyone to take care of yourself and your family. Talk about your concerns with your loved ones and look for creative ways to spend time with them. Finally, thank you, Clay County, for your courage and commitment. Your physical distancing is working. I have a few announcements regarding the Clerk of the Court operations on behalf of Tara Green. Expanded payment plan options are available to prevent falling behind on court-ordered payments. Please call 904-269-6302, extension 4772 for details. Residential eviction process steps remain, unfortunately, except for physical removal. Residents who are served with an eviction notice should contact the clerk's office at 264-6363 for details. And finally, COVID-19 court date postponements remain. Those with pending cases should check the judge's website at www.clayclerk.com and register for e-notify. Now, let's all continue to work together to stop the spread of this virus so that we may reopen Clay County. Thank you all, and we'll take some questions.
I have a question actually for Administrator Huffman.
Hi.
You talked about long-term care facilities, and we know from different attorneys and HIPAA experts that giving out information on how many cases there are at each facility is not in violation of that law. We know from families here in this county and across the state that they don't feel they're getting an accurate picture of how many cases, how large an outbreak is at a facility, whether it's one case that's now been taken out of the facility or whether there are multiple. Have you gotten any reasoning from the state health department as to why you guys are not releasing that information? Georgia has.
So we're following the direction of the state surgeon general and the governor. Up to this point, and through other outbreaks that we face related to H1N1, years past Zika, we've never released that kind of information. This is the first time that you've been able to actually get facility information. We don't see the value in telling you if it's one case or three at this point. It's not going to change our situation. The families are to be notified from that facility if there's a positive, just like if there was another kind of communicable disease going on within that facility. They would report those back to those families and or residents depending on their current situation.
But we are hearing from families that they are not getting that they're being told about the original case, but then they're hearing from others about other cases that might be in there. Are you following up with these facilities to make sure they're distributing that information to the families?
So these facilities are regulated by the Agency for Healthcare Administration. I work for the Department of Health, so we would have to follow with ACA as far as how they're doing that on their end. When I've spoken to many administrators that we have here in the facilities in Clay County, we have talked about those, and they are saying that they are doing those notifications to those families and or residents.
My last question for this. Now, while you've made your point that you guys haven't released that information in the past, it is public record through the Florida Department of Health and ACHA. We know we've made requests for that information, and we know other media outlets have as well. Would that not mean you have to release that information?
Not necessarily. Our attorneys go through any public records request, and they deduct the information that would be pertinent to release to the public through media or even public request. Any other questions that we can answer for you?
Yes, this has probably already been asked and answered, but I keep getting people out in the community that do not have the information. If a person feel like they have the COVID-19 symptoms, where do they go and who do they report to get checked? And that's, again, very basic.
So the first avenue for getting testing, if you have any kind of symptoms, is to reach out to your private provider. We want you to have a relationship with your private provider. We want to continue that relationship. We do have a regional testing site. It is available to anyone. It's not based on county boundary. That is the TIAA Bank Lot J. They are doing much more testing than when it was a federal regional testing site. And that is open every day of the week. And so you can go there. You just have to report if you've had any signs or symptoms. Temperature is not a requirement anymore. Or if you are asymptomatic and you've been a contact to a known positive, you also can get tested there.
And a follow-up question, a lot of our citizens have consternation about having to drive to Jacksonville, and their question is, why don't we have it in Clay County?
So there's a couple of reasons for that. One is it's very costly to set up these sites, and it's a lot of huge amount of overhead that go with that. It's not as simple as just having a drive-through and somebody there to swab you. You know, you have to have different avenues as far as protective factors set in there, and it's a high amount of PPE that has to be used for these testing sites. So we've tried to work with those individuals that have called us related to that, but ideally they should be able to work with their private provider to get that testing done.
I have a question for the superintendent.
Sure.
Hi. We were told that there may be some differences in how you guys are approaching grades for the remainder of the school year, using grace during your grading. And can you tell us what policies you set for handling grading while you guys are doing distance learning?
Yes. The only change really in guidance in grading is that we believe that you should take into account the students' 3/4 of grading, their whole academic history, when making a determination in the 4th quarter. So we did put that guidance out. We do believe in grace and compassion. Every student learns differently, and now we've thrust all of these learners into a different environment. We've also thrust a group of parents into a whole different environment too. So we've kind of said grace over grades, given the environment that we're in. This is a worldwide pandemic. This is very unusual times.
We were told that they can't be graded lower than they've made in the average of the last 3 quarters. Is that correct?
Now, the advice was that students' grades in the 4th quarter should not be below the average of the 3 quarters that they've already demonstrated.
Okay, thank you.
Okay, any more questions? Thank you for all your time, and please remain vigilant. Thank you.